Hello, I'm Dr. Martin Schmaltz, and in this video we want to address some of the common myths about carpal tunnel syndrome. So jumping right in, the first myth that many people have is if there's any pain, numbness, tingling in their hands or fingers, they assume that it's automatically carpal tunnel syndrome. The fact of the matter is there are many conditions that can cause those type of symptoms. Some of the more common ones can be a pinched nerve in the neck that runs down to the hand. There can be a irritation or pinching of the nerve in the shoulder or even in the elbow. Some other things that we see very commonly is you can have subtle misalignments and loss of motion of the spinal bones irritating the nerves, not necessarily pinching, but irritating the nerves that cause symptoms down into the hand. The real answer is to have proper diagnostics done to determine if that is the cause of the symptoms in the hand. Second myth about carpal tunnel syndrome is a lot of people say, well, it's always associated with keyboard or typing. The research has actually shown there is no direct correlation between keyboarding, typing, and carpal tunnel syndrome. And practically speaking, when you think of the almost probably billions of keystrokes done every year across the world, there's only a small percentage of people with carpal tunnel syndrome that actually do the keyboarding or the typing. The third myth about carpal tunnel syndrome that I want to bring up is that people think, well, once you have it, the only real answer is to have surgery. Well, the fact of the matter is in our practice, we've seen quite a few people who've already had the carpal tunnel release and their symptoms still persist. One of the things that we have found in those situations is that there have been other causes related to the symptoms in their hand that they missed. So therefore the surgery didn't relieve all their symptoms. There's one syndrome called double crush syndrome, which means that not only may there be compression or irritation of the nerve in the hand, but there's also irritation of the nerve somewhere else, as I said, either in the neck, the shoulder, or the elbow. So relieving the pressure on one area doesn't totally relieve the symptoms. So there's a lot of myths around carpal tunnel syndrome, and just kind of give you a little heads up, a little ability to kind of check on your own condition. Carpal tunnel syndrome primarily affects what's called the median nerve, which goes through your wrist, and symptoms usually are a tingling or a numbness in these three fingers, your two fingers and your thumb. So that's primarily the distribution of what we call the median nerve. So if you got symptoms there, it might be carpal tunnel syndrome. The best advice I'd have for you is give us a call, check us out, see what we can do, see how we can help you resolve your symptoms.